Okay, hope everybody can hear me. Welcome everyone. Thank you for joining us for today's webinar. I'm Mary Jo Spence. Andy Davis, my peer, is going to be available as well. And we are the hosts with Energy Safety Canada. Today we're presenting Building Mental Health into Emergency Management and Business Continuity Programs. We are recording this webinar and it will be featured on our webpage for viewing at a later date. If you haven't already done so, make sure you turn off your microphone, and if you want to, turn off your video. We're using the chat function to submit questions. Post your question at any time by clicking on the chat icon on the bottom, or in my case, the top of my screen. We also have some feedback options. Views can provide basic feedback and answer questions. And us as hosts will be looking at sorry, I have a bit of a delay on my machine. Apparently I have the cheap internet. Eventually this screen will change. Andy and I will be monitoring some of the questions, just making sure that they get in front of our presenter. Eventually my screen will change, I promise. There we go. To get everyone used to the controls and have a quick function test, can everyone see the presentation and hear clearly? Just go to participant menu and say yes or no. I'm going to go with yes and continuing. Andy will watch, and if anybody can't hear, let us know. Oh, I see a whole bunch of names of people I know. We're not going to be doing any polls today, but we will be doing a feedback loop at the very end. So this is what the chat looks like. Someday this will change again. We'll go into the next. So I guess some of my feedback is don't take the cheap internet and take the stronger one. Yeah, I don't know why this is doing it. Sorry, y'all. Well, I think what I'm going to do is I am going to not advance my slides because my slides don't want to. Oh, there we go. Now my slides, apparently I have to hit them. If you can see the presentation, I think everybody's saying yes. And I'm going to turn it over to Liz Horvath, who is the Manager of Workplace Mental Health, Mental Health Opening Minds Mental Health Commission of Canada. So I'm going to turn my remote over. Oh, hang on. I need to get her slides up first. There we go. There you go, Liz, all yours. Don't forget to unmute yourself.
I'm gonna find it. It says, there we go. Okay, great. Thank you very much, Mary Jo and Andrew, for hosting this, and thank you all for being here today. Can everybody hear me okay? You can just type yes if you can hear me. Just want to make sure that everyone can hear. Excellent. Okay, well, thank you again for joining us. Slide went forward before I was quite ready for it, but that's okay. As we begin navigating through this pandemic, you know, we're beginning to think about how to recover our operations and the economy. And it's really critical to think about how to build mental health into our emergency management and business continuity plans. You see, emergency management and business continuity plans typically focus on minimizing the risk and the impact around physical injury and property damage, and also the economic impact. And when there's an outbreak or an epidemic of a serious infectious disease, your organization's emergency management and business continuity programs need to involve your infection prevention and control protocol if you have one. Not all organizations have one, so that should be invoked. We're going to talk about that a little bit later. But during a pandemic, the challenges are really extraordinary, especially if governments invoke the emergency public health measures like we've seen to stop the spread of infection. And what we know is that this situation can change suddenly, it can change drastically. Whoa, my slides are going forward without me pressing anything. Okay, let's try and go back a little bit here. It's jumping forward on me. I do apologize. We seem to be having a few little technical glitches, but that's okay. I'm still going to continue going through here. So as I said, the situation can change suddenly and drastically, and you know, your normal emergency response and business continuity plans may not be sufficient in this case. So the goal of this webinar is to help you build mental health into your plans. So we're going to cover the potential impact of emergencies and disasters with COVID-19 in particular on the mental health of workers. We're going to talk about mental health needs when dealing with emergencies and disasters, including infectious disease pandemics, and how to use the National Standard of Canada on psychological health and safety in the workplace to build mental health into your programs. And so before we really jump into the solutions, I want to take you through kind of what the functional areas of the brain are that are affected. So this is kind of what happens. When we're dealing with stress, we have this thing called the fight or flight response. And I'm sure everybody's heard of this. So here's what happens. You see a diagram of the brain on the screen here. And deep in the center of the brain, there's this thing called the amygdala. Now you can't see it on this slide, but believe me, it's in there. And when we are under stress, extreme stress, like a threat or a danger, the amygdala fires up and it starts to say, okay, there's a threat. What do I need to do? Do I need to hide? Do I need to flee? Do I need to fight? And it signals the release of what we know as stress hormones. So cortisol, progesterone, testosterone, epinephrine, and dopamine. These hormones are what gives us that burst of energy that we need. Now, when that happens, some of the higher functions of the brain start to shut down a little bit. So as you can see there in the frontal lobe, there are things like thinking, speaking, reasoning, problem solving. And then in the temporal lobe, memories, hearing, behavior, and generating emotions. These things are kind of pulled back. Now, what happens then is that these higher functions of the brain are at an increased risk of not working quite maybe the way that we would want them to during those high stress times. Now, when we think about what that looks like in the case of a pandemic, I'm waiting for the slide to move forward now, so hopefully it will. Of course, this worked all beautifully when we tested it the other day. Anyways, when we start to think about what happens when we're under stress for a prolonged period of time, what we start to see is that there's an increase in the, a decrease in these areas of thinking, speaking, reasoning, problem solving, those higher functions. We can start to feel really tired. We can start to get indecisive. We can see that we're fuzzy-minded. We may become exhausted or even irritable. We may have increased feelings of anxiety and kind of leaning towards burnout. So what I'm saying is that not all stress, there we go, not all stress is harmful. We do know that there's a level of stress which we tend to work really well under, and that's the area of peak performance, where we feel energetic. We may feel tired at the end of our day, but we're generally able to, you know, do our work, and we're able to enjoy our life at home outside of work as well. We've got energy. Where we have the increased pressure and the overpressure and the increased stress, we start to get into this red area that you see on here. So what we know is that when we're trying to get through a pandemic, these issues of fight or flight and the overwhelming experiences that we may be going through because of all the added stresses may be causing us to be more in that area of stress and overpressure. And that can really affect us. And the key here is that we want to balance demands of life during this pandemic with the resources that we need in order to be able to operate at peak performance, both at work and outside of work, because it's not just all about work. I think you'd probably agree with me there. So I want to ask a quick question here. What do you think, based on what we've just talked about, what do you think are the benefits of building mental health into your emergency management and business continuity plans? If you can type in your answers on the chat screen. Don't be shy. Okay, so less employees taking stress leave. I mean, well, it's going really fast. Better recovery, important for people struggling with mental health at this time. Less lost time can lead to more productivity, brings awareness in the workplace, better recovery. Yeah. Allows workers to feel that this is not abnormal. Yes, and these are all very, very important, and you've hit on quite a few very important things. Becomes part of your business versus only being reactive, and that's really the key. I mean, you want this to become part of how you do business. So thank you for taking some time to answer that question. Now, we do have some research on the effects of emergencies and disasters, and even some on pandemics, although we haven't had a global pandemic like this for a very long time. But we can take some of our learning from this to see what we need to do moving forward. And so this report, Protecting the Psychological Well-Being of Staff Exposed to Disaster or Emergency at Work, this is a qualitative study. And what they found were that there are positive effects as well as negative effects. And I think we tend to hear about the negative effects so much, but all we have to do is be on social media to see that there are positive effects too. What we're seeing is a massive boost in morale and confidence when people respond well. They come together. There's a new appreciation for life as we go through these kinds of things. There's greater emotional maturity as people grow through the pandemic. Or through any emergency or disaster. And there's certainly greater compassion and sympathy and understanding for people in difficult circumstances as we start to learn more about how difficult things can be. But there certainly are the negative effects, and this is what we want to try and minimize the risk of by minimizing the amount of stress that people may be under. And so some of the negative effects, like you see there, shock, helplessness, worry, fear, guilt, fatigue, exhaustion. I mean, we're all kind of feeling these things, but there are some that I want to really point out too. There's distress, like higher levels of distress for anyone who is a caretaker, and that could be, you know, taking care of someone who's sick at home. Could be a child, could be a spouse or a partner, or could be elderly parents. It can also be taking care of people who are outside of the home. And I know quite a few people, myself included, who have, you know, parents outside the home who need our help. And it's very difficult to help them during this time. I know my mother in particular said, don't come in the house, you know, so it's harder for people when you're trying to take care of someone else who needs your care, and you've got these added layers of barriers there. We do see higher levels of PTSD and depression and anxiety, especially when someone has had an infection, but also when people are taking care of others. In fact, studies have shown that workers who have routine exposure to trauma, such as rescue workers and police and body handlers and firefighters, they have high rates of PTSD and depression and anxiety and other mental health problems after these emergencies and disasters. But workers who are not routinely exposed to distress, to trauma, also are showing that they have high levels of distress and mental health problems after an emergency or disaster. And the effects that they're seeing are similar to those of rescue workers. But here's and then there's one other one here that I want to talk about just briefly: vicarious and secondary trauma. And this is where people really start to feel the effects of trauma through the stories or the images or what they're reading secondhand. It could be that someone has come and they really need to vent about what they've been through or what they've seen, or it could be part of the job where you're having to go in and maybe you're first or second on the scene, or you're having to help someone else who has been through that trauma. Those secondary and vicarious traumas can really affect a person. And then the other thing that we have to be aware of is that a secondary trauma can happen when something about the emergency or disaster, or something about the pandemic, or what people are seeing or going through, triggers a past trauma, and then it ends up coming up again, and that person starts to have declining mental health. So these are some of the things that we're seeing in the studies to be aware of. And that's the reason that we're focusing on a pandemic response plan. Now, the goal of a pandemic response plan, of course, is to protect the health and safety of workers and other people. It's also to ensure business continuity, but you really have to get down to the objectives. Minimizing the risk and potential impact of infection on workers and the business throughout the lockdown procedures and as we're getting the economy back up and running. Supporting workers to perform essential work to meet the stakeholder needs in a healthy and safe manner. This is what it's all about. It's not just getting the economy back up and running, but how do we do it in a manner that is healthy and safe for everybody that needs to be protected? Minimizing the risk and potential impact of both physical and psychological harm that can arise from those emergency measures, ensuring a healthy and safe return to work, to normal working conditions following the pandemic, and planning for post-pandemic psychological support. Because even once things appear to be back to normal after an emergency, there's long-lasting effects for some people, and we have to recognize that those long-lasting effects can really affect not only an individual worker, they can affect their family, they can affect their coworkers, and we need to provide the support for people on an ongoing basis to be able to get through this. So I'm going to talk a little bit about the stages of an emergency. When we are looking at building mental health into emergency management and business continuity programs, what we've looked at is some of the standards. Now, of course, we're going to talk about the National Standard for Psychological Health and Safety in the Workplace. But here we're also going to talk a little bit about CSAZ 1600, which is Emergency and Continuity Management Program. And there are other standards, certainly, that are more focused on particular industries or particular hazards, especially getting down to critical incident response, but that's not what we're talking about here. What we're talking about is the overall management. And there are 4 stages to an emergency. So prevention and mitigation, preparedness, response and continuity, and recovery. At the prevention stage, this is really where you would look to mitigate, limit, or control the consequences, extent, and severity of the incident through prevention measures. And prevention strategies include things like activities, tasks, programs, and systems that are intended to prevent a threat or a hazard from occurring in the first place. Now, of course, with the pandemic, we're kind of, further down that road now. So there are some things that we're going to talk about, some prevention strategies that you probably would have wanted to see in place at the prevention stage. But if you haven't already got them in place, there's no time like the present to get them in there. Also at the prevention stage, one of the things that would be done would be an impact analysis. And this generally looks at the impact on operations as well as the foundational elements. So it looks at the risk assessment. What is the risk to our people? What is the risk to our property? What is the risk to the organization? What's the risk to the public if this emergency happens? And what do we need to be able to prepare for it to bring that risk down to an acceptable level? So we would look to do an impact analysis. Really important thing to note with CSA Z1600 is that in that impact analysis, the health and safety of people is the first item listed to be considered among the impacts. So always look at the health and safety of people first. At the preparedness stage, business as usual, we're still going on, the emergency hasn't happened. You're really looking then at figuring out how do we combine the prevention strategies with what we're already doing. So just like was said earlier, having it become part of the way that you do business. So this is where you're looking at development, implementation, and maintenance of those systems to support you in an emergency or disaster. And certainly in the oil and gas industry, you have a lot of these systems built in with respect to some of the emergencies that you deal with. But as I said, what we're talking about here is also building mental health in. At the response and continuity stage, we're looking at activities, tasks, and programs that help to preserve life, that meet basic human needs, that preserve business operations, that protect the property and the environment, and also doing a situational analysis as the need continues, because things evolve as you're going through the response, as the emergency is going on. And then you get into the recovery stage, which we're kind of in the response and continuity stage right now. We're not at the recovery stage yet, even though we're looking at starting to try and recover some of our business operations, but we're really still in the response and continuity stage. So we have to keep doing those situational analyses to see what do we do next. But we can also look forward into the recovery stage to see what else needs to be done. This includes things like meeting our contractual obligations, what are our core activities, how will we continue, how will we manage those core activities as we get things back up and running. You know, making sure that we're continuing to reduce the risk and make any improvements to our processes. So some of those preventive actions that you would want to see in place to help with mental health in the workplace are things like reducing stigma through training. Stigma reduction is one of the main things that helps people to feel comfortable with coming forward to talk about what they might be experiencing with respect to their mental health. And just like somebody said earlier, that aspect of letting people know that, you know, it's a normal reaction to abnormal circumstances within this time, and it's okay to come forward and talk about it and reach out for help. One of the things that the studies showed is that providing training on recognition of signs and symptoms of mental illness and guidance on where to go for support is so extremely important, because while a lot of workers may think, oh, I would know if something is going on with my coworker and I'd be able to recognize it because I know that person, we have to remember that because of stigma, people will generally be very good at hiding what they're feeling if they're not comfortable with coming out and talking about it. So unfortunately, more than 60% of people don't reach out for help until they're further down the road of mental illness. And so this is why recognizing the signs and symptoms or the indicators of mental illness are so very important, because it will help you to be able to come forward and talk to that person about where to go for guidance on where to go. And we're not talking about being a counselor or a therapist. We're just talking about knowing these signs and symptoms and how to address them in the workplace. Education about trauma and its effects, education about cumulative stress, and certainly training for managers and supervisors on interpersonal skills and empathy. These are all things that were identified throughout those throughout those studies that showed what the most important parts of helping people with their mental health through emergencies and disasters were. Now, the Mental Health Commission and a lot of other organizations are providing a ton of resources for people during this time. And I would invite you to visit the Resource Hub. We have quite a few tools there that are free that you can get, that you can download. The Self-Care and Resilience Guide for the Working Mind, for example, is an excellent tool that can help with some tips. There's also a guideline on tips on talking to someone in crisis during COVID-19 that I really strongly recommend that you download it and have a look through it and maybe practice it, so that if you're in that situation where you do need to talk to somebody and they are feeling that they're in crisis, you'll kind of know what to do without having to pull the tip sheet out. And we're also offering free crisis response virtual training for essential services, for essential service workers. So if you'd like to sign up for any of that, then please do. And as I said, there's a lot of organizations that are providing free resources. Now, one of the resources that we provide, which is the Working Mind. Now, we have a full course on that as well, and it goes into the indicators of mental health, of mental illness and mental health, and it has this mental health continuing model. What I want to clarify here is that we are all somewhere along this continuum, somewhere between being healthy and being ill at any particular time in our lives. So really understanding that, you know, when we have these outbreaks of infectious disease and we're dealing with a pandemic that is so widespread, we have to recognize these within our workplace. So when we're checking in with people, when we are talking with our coworkers or with our direct reports or our managers even, we should be really trying to recognize, you know, are there indicators here that I need to be aware of? And what can I do about that to try and help, and even in yourself, you know, to try and help yourself or that other person be able to get back into the yellow or even into the green. That's what this is really all about, is making sure that we can try and prevent people from becoming injured or from becoming ill, and to help those people who are in the injured or ill part of the spectrum to get back to a level of health. But we have to understand too that in the case of a pandemic, there may be various reasons why a person may not come out and talk about what they're feeling. It could be fear, panic, stress, could be medical mistrust. We're seeing a lot of that. There can be anxiety disorders. So while it's not, you know, you're not going to say, you know, are you suffering from a mental illness? There are ways to be able to talk to a person about that. And so training, as I mentioned on the previous slide, training for managers and supervisors, and really helping to understand, you know, what are those indicators and how do I respond to them if something is happening, are very important. So what are some of the other, I'd just like to get a sense of what some of the other resources are that you're aware of that you're finding helpful. You can take a moment and type that in. Okay, yes, company EAP, so Employee Assistance Program, the Not Myself Today campaign. Mm-hmm. Yeah, these are very important programs. I mean, if your organization has an employee assistance program, I really strongly recommend that that you use it. They usually do have a lot of great resources in there. Yeah, also seeing OHS, BC WorkSafe has great resources. CCOHS, yes, Canadian Centre for Occupational Health and Safety. Yeah, lots of great resources out there. And in fact, CCOHS has an excellent guide on business continuity. And And so that's one of the guides that we refer to as well. So as you're going into the recovery stage, you know, starting to think forward, think about the strategies to restore business to an acceptable level. There's a checklist here. You'll have a copy of these slides. So I'm not going to go through every single point on all of the slides with you, but certainly, you know, as you're starting to go through, have a look at what the recovery targets are. Consider needs of employees in their personal life. Consider staggering return to work. Many of you are likely already working, but you may also have people working from home as well, or people who have been laid off and perhaps you're starting to look at bringing them back. So you'll have to be looking at how do you make sure that you have protective equipment available for everyone, disinfection, transportation also may be an issue, and proactive follow-up and debriefing methods. So we're going to talk about how to look at this in kind of a systematic way through the psychological health and safety standard. So how many, if you can just type into the chat if you're familiar with the standard, just to give me an idea if people, how familiar people are, if you've seen it or if you haven't seen it, just type yes or no. Yes. Okay, so, okay. So it's looking like about half and half for a few people. Oh, getting a lot of no's now. Okay. Well, this standard, I'll let you know, is it was published in 2013. It is free. I've given you the link there to be able to download it. It is a management system standard, so it's based similar to an occupational health and safety management system. This is a psychological health and safety management system, and it does go through the Plan, Do, Check, Act process, and it does include identifying hazards and doing risk assessment and controlling that risk. And what they've done in the standard is provided the workplace factors that you would want to look at when you're doing the risk assessments. And some of these workplace factors we know are more significant when we're dealing with emergencies and disasters. All of these factors are interrelated, and so improvements in one area will make improvements in another. But at the same time, not managing one area well will also have impact on some of the other areas. And so it's really important to look at the workplace factors and what they actually mean. So we're going to go through a few of them here that are important when you're looking at building mental health into these programs. So clear leadership and expectations, of course, is one of them. And this is so extremely important because when we're going through these emergencies and disasters and pandemics, and the level of confusion, the level of uncertainty, and the amount of change that we're going through is rapid, and people need to know what leadership is doing, and they need to know what the expectations are of them as well. So just like in any other, in any emergency, you would want to have a communication plan, and you want to communicate about health and safety measures, and you need to have a chain of command. People need to know these things, but there's additional things that should be built in. So things like acknowledging the fears and concerns and the feelings that people are feeling to help them get over that stigma, to help them to be able to step forward. Because if we're not operating in that optimum area, the risk of errors and the risk of accidents increases. So it's really important to acknowledge what people are going through and help them to be able to talk about what their needs are. People are working really hard during this time too, and we know that a lot of people are juggling multiple roles, with schools being closed and daycares being closed, and you know, some people are working at home with their spouses or their partners or other people in the house, trying to homeschool their children and trying to do work at the same time. Or you're out in the field doing work and concerned about what you might be bringing home, or how you're doing the work and whether you're being protected to the best of ability. People are working really hard right now. So one of the leadership goals is to celebrate successes, recognize the hard work that people are doing, and reward them for that hard work. Also communicate about things like understanding the signs and symptoms of COVID-19 infection, but also those signs and symptoms of declining mental health that people need to be aware of. How are you accommodating people who may be high risk? We're going to talk about that in a moment. Definitely communicate the expectations to comply with the law and any guidelines, what the resources are that are available, and what are the credible sources of information that you would want to draw people to. Now, another one of the workplace factors is protection of physical safety. And what the standard says is that this is present when a worker's psychological as well as physical safety is protected from hazards and risks related to the worker's physical environment. And what we know is that when a worker does not feel physically protected, there's a heightened level of fear. There can be a heightened level of stress and anxiety. And people who are out working out in the public or working in the front lines in essential services may feel an even more heightened risk during a pandemic. So it's really important to address both the physical and psychological safety in the physical environment. And we do this through a number of procedures. So we have to put preventive measures in place. And those preventive measures have to address the level of risk that a person is experiencing with respect to exposure to the virus, as well as exposure to other hazards in the workplace. And so making sure that you've got that infection prevention and control protocol in place, and that protocol will continue forward throughout the whole pandemic response and beyond. If you don't already have an infection prevention and control protocol, then I would really recommend connecting with someone who is qualified in this area to help you put that in place. Really getting down to figuring out, how do I accommodate people, making sure that that there's controlled access, that you are disinfecting the workplace, that personal protective equipment that people are having to use is able to be disinfected, and proper storage, and you're following the SDS and the instructions for cleaning and safety. Another thing that people tend not to think about is first aid procedures and first aid equipment. So what updates do you need to do for people who are responsible to provide first aid during a pandemic? Do you have the right equipment there for them to be able to do that and feel safe themselves, so that they're not put in a situation where they might be at risk of exposure? So you want to look at all of these various aspects. You'll also be needing to look at whether there's continued travel restrictions, and how do you implement the safe distancing guidelines. So these are all things that I'm sure you've heard a lot about. I mean, the governments have been giving a lot of information about these things. One that I want to talk about here too, though, is work at home guidelines. If you have anyone who's working at home, you would want to help them to make sure that they are set up well ergonomically, because ergonomics can also have a direct impact with mental health. And if you need some help in that area, we'll be publishing on our website very shortly a temporary work at home ergonomic guideline that helps to make that connection. Now, when you're looking at protecting high-risk workers, you want to consider whether people need to have accommodation for anxiety or mood disorders. You may want to ask them to self-identify if they are in need of accommodation. And this can be, the accommodation can be in various ways. So you can adjust the workload or schedules. You can talk to your benefits provider about access to treatment. Sometimes access to treatment doesn't go on long enough. You can actually talk to your benefits provider about increasing the duration or access. We also know that there's access to free mental health support, free counseling and therapy right now. And on one of the other slides, I'll give you the information about that. Make sure to do systematic check-ins, really talk about, how the person is feeling, especially if that person is home alone. You might want to put together a buddy system. Sometimes people won't feel comfortable about talking about what their challenges are, especially with a manager or supervisor, but they may be feeling comfortable talking about it with a buddy. This has been shown to be very, very helpful. And have a look at it, whatever additional supports. So there could be things like video counseling through the EAP, for example, or through the online services that are available. You might want to look at additional supports to help people to be able to focus as well. So things like meditation supports, perhaps headphones to block out ambient noise if they're in need of those kinds of things. Psychological and social support, again, very important because people are dealing with increased levels of stress and anxiety during this time. So you might look at things like, do we need to have a self-care coordinator or access to a self-care coordinator on staff? Maybe we need to have a spiritual care counselor who can provide that kind of care for people, particularly if they're dealing with a traumatic situation. Peer support teams are extremely helpful. And if you're putting together a peer support team, then I strongly recommend that you get training. There is good training available for peer support teams. How many people have mental health first aid training or mental health first aiders on site? Anybody? Okay. Yeah, we've got a few. Okay, quite a few no's, a few yeses. Never heard of that. Okay, so you can visit our website on that. Mental Health First Aid is an excellent program that can help with understanding what a person may be going through with respect to various types of mental illness and how to help them in a crisis situation. So similar to physical first aid, this is mental health first aid. And we've trained actually over 500,000 people in Canada on mental health first aid, but it is a worldwide program. There are mental health first aid courses in other countries as well. It started out in Australia. Okay, now some workers may have an obsession and cleaning pardon me, tripping over my words here. Some people may have a contamination obsession and cleaning compulsion, and this puts them at greater risk of things like dermatitis, but it also puts them at greater risk of inhalation hazards. So really taking some time to help to lower the stress around contamination within the workplace, helping people to understand how to use chemicals safely, what personal protective equipment they may need to use, and making sure that the procedures are in place that will make them feel comfortable that they are protected. So you may need to talk with people if you notice these kinds of signs or symptoms that may be happening, and provide those supports that can help them through these types of things. So here's the link. Well, actually, it's a web page for the Wellness Together Canada. This is a brand new resource that has been put together to provide mental health and substance use support free of charge for anyone who needs it. So you can go online, anyone in Canada, you can go online and you can develop a profile and go in and get this type of support. And it is totally free. And from what I've seen from some of the reports on online virtual counseling, that it is very effective. They don't have a lot of research on it yet, but from some of the research that has been done, it is very effective. And you don't even have to leave your home to take advantage of it. Now, one of the other things that you would want to help people with is transitions between stressful events. Certainly during this time, people's stress levels are higher, and whether it's a particular event that's stressful or you've had a kind of a difficult conversation with someone, there's different ways that you can help people through these stressful events. I've given some examples here, things like dissociation and deep breathing. Deep breathing is extremely important. You know, when we can get the oxygen down deeper into our system, it helps to improve, it goes right into our digestive system, which has a very, very critical link between our brain and the rest of our body. So those deep breathing exercises really do bring the blood pressure down and really do help to get those higher functions working well again. It helps to calm down the amygdala. There's a couple of other links here I've given you. The pause is a medical, it was developed by a nurse who found that, you know, after they lost a patient, they would go just from one, they'd leave right away and they didn't have time to process before going into the next patient. So he developed this process called the pause, where they basically take 45 seconds to a minute just to be quiet and recognize the hard work that they did. Now, I know it's a medical procedure or a medical process, but this pause can be used in any type of situation, whether it's a work situation, whether it's a home situation. You can still take that pause to acknowledge the work that you've done, to acknowledge that other person, and to acknowledge just the fact that, you know, I just need a few minutes to honor what we've done here. And then low impact debriefing, I'll leave that one with you. I really strongly recommend you go and have a look at that. This is basically a 4-step process for psychologically safe debriefing when someone has gone through kind of a stressful event and they need to kind of unload and talk to somebody. Well, if someone wants to come and talk to me about a stressful event, but I'm not in a mental state to hear it at that time, that can put me at a heightened risk. So really learning the process of low impact debriefing is important for everybody. And the 4 steps in it are, first of all, being self-aware of the stories, of the story of what you need to say, and the fact that stories are their own contagion, and that you can pass along that trauma, that stress to someone else. Giving that person fair warning that you need to have this talk and gives them the opportunity to prepare, and asking for consent. So can I talk with you about this? Can I debrief with you? If I'm not in a position or a mental state to be able to take that debrief, then I can either say no, or I can refer you to somebody else who can help at that particular time. And then limiting the disclosure. So really understanding, you know, starting with the less traumatic stuff first and then building up, but not necessarily getting into all the gory details. So this is a really good form of debriefing. And then also looking at access to professional debriefing. And this is where you may have a group of people coming together to debrief after an emergency, disaster type of event, but it's overseen by someone who is qualified in professional debriefing so that they can really monitor the state of the people going through it. So a few more things here. Psychological protection is another one of the workplace factors. And this is really important, especially if you are a manager or supervisor or in a leadership position. It's important to know that you need to uphold your organization's policies and procedures for civility and respect in the workplace, and no discrimination, no harassment, no violence. it's very, very important. We're seeing an increase in social stigma and xenophobia. Xenophobia is discrimination against people from other countries, and we're seeing a tremendous increase in this against people who are of Asian descent, as well as some other ethnicities as well. So it is important as an organization that you uphold your policies and procedures, but also, you know, be aware of it up front and making sure that that not only are you upholding it if it happens, but take the steps to prevent it from happening by letting people know that it's not tolerated, that it won't be tolerated, and that anyone who is experiencing any sort of social stigma or xenophobia are welcome to come forward and let you know that they may be experiencing some issues there. A few other things that you want to have a look at. Again, I'm not going to go through them in great detail, but some of the other workplace factors include things like workload management, psychological demands, and balance. And this is a really good time to have a look at augmenting your staff or being able to say, okay, how can we do the work in a different way? Are we overloading workers in one area and not utilizing the talents in another area? Is there an opportunity for growth and development here where we can redistribute the balance? Now, I know that if you're in a unionized situation, that may be a little bit more challenging, but you know, you have to look at your collective agreements and see how do you build that in and work with your union on, you know, how can we make this work? One of the things that I really strongly recommend is when you're looking at, you know, if you're saying, okay, work is flexible, and, you know, take the time you need or do what you need to support your own well-being, that's all fine. But people tend to need a little more support than that. So if you're saying you're going to allow people to work by a flexible work schedule, define what that means. What does a flexible work schedule mean? Because if you say you can work a flexible work schedule, but then still expect that everybody's there during the normal times, that's not a flexible work schedule. Whereas they're still having to deal with all those extra things that they're having to deal with during this pandemic. So put some parameters around that and put it in writing, put it up on your intranet, communicate it out so that people know what is actually expected. Very important to encourage workers to take their breaks, especially during these times. Some people will feel even more guilt at taking a step back and taking time when they may feel that others are struggling or suffering so much. And so it's very important to make sure that people take their breaks and use their time off. Now, this is going to be a difficult discussion in some cases because people don't want to take their vacation when they can't go off and do things, right? Because things are shut down. But you also have to think about the fact that people just need to shut down for a little while away from work. So really look at how to encourage them to do that. Another one I want to touch on here is establishing a safe space for dialogue about challenges and needs. People need to have that safe space. So whether you have a room at your physical workplace, whether you have a virtual room that you're able to go into, whatever it is, make sure that that safe space is established, and certainly that that what their needs are being considered, as well as your own needs. It has to be safe for all of the people that are within that space to come forward and talk about whatever it is that might be bothering them and what their needs are. Okay, so that really brings me to the end. And what I want to do is I want to ask you to think about what is the most important thing you learned from this webinar. And then from there, identify at least one step that you will take this week to move forward with integrating psychological health and safety into your emergency management and business continuity programs. And if you need any help, if you are looking to have any questions answered, I'd be happy to answer your questions beyond this course. We've also provided this webinar previously in French as well. And we will also have these webinars posted on our website. And so if you have questions either in French or English, we have the ability to answer those questions and help you with moving forward. So I do apologize, I kind of got right to the end of the time here, but if you're able to stay on and we can open it up for a few questions, I'm happy to do that.
Hi, Liz. This is Andy here. Can you hear me?
Yes, thank you.
Okay, excellent. Thank you so much. Actually, we're going to short circuit that question period just for a minute. We do have a hard stop at 1 o'clock, but we'll continue on and take a few questions after, if that's all right with you, Liz?
Sure.
Okay, you bet. All right, just a reminder for everyone who is still with us, we do have some upcoming webinars. You can register at www.energySafetyCanada.com/events. Tomorrow, May 21st, we have 2, Cargo Securement and National Safety Code 10. Also workplace exposures with my coworker, Robert Waterhouse. And then May 26th, Fit for Duty, Don't Be a Hazard. So please do sign up for those. And then if you could please fill out our feedback survey. You should have received that survey a few moments ago. It will be in your email. If you didn't, you can log into surveymonkey.com/r/webinar mental health. And that'll be it for the recorded portion of our webinar. If anyone has any questions, we'll get to those in the chat in just a few minutes. Thank you very much, and we hope to see you later tomorrow.
Thank you, everyone.